Hi everybody, welcome back to my channel. Mari here. I am sitting in the parking lot currently. It is lunchtime. It is 12 p.m. so I'm taking my lunch break. It is Tuesday and I am doing my clinical rotations, but this time it is not at the hospital. This time I am at a clinic. I wanted to talk a little bit about the different places that you get to go to as a nursing student for clinicals. So I'm not sure how other places do it, like other schools do it when it comes to clinicals, but of course, as always, I'm going to talk about my experience. I really appreciate, I guess, the fact that we get to experience different clinical rotations within the semester. What I mean by we get to experience different rotations is that we don't only go to a hospital for clinicals. We also get to go to a clinic. Like for me today, on Thursday, I'm going to be going to an intermediate school and I'm going to follow the school nurse. So it's just a different environment altogether that we're getting to experience. And what I really like about that is that we get to see the role of the nurse in different settings. Before I actually started to go to these different places, I would always think of like nursing, oh, you know, I'm gonna work at a hospital and that's it. But of course it's not. Nursing is, you know, one of those jobs where you can basically work everywhere. It's a pretty cool thing because if you ever decide that you don't want to be in a hospital, you can always go work at a school, or you know, you can work for a company, or you can work at a clinic like today. So I feel that it's a very versatile career that you can do so much with it. Today, let me just give you a little rundown of what I did with my nurse today. I mean, as always, when you go to clinicals, you're basically just following around your nurse and, you know, experiencing what they do and you know, maybe help here and there depending on what they're doing. So today my nurse was basically she was just checking in patients, and you know, she would take vital signs, and she was just prepping the patient for the doctor, for the doctor to come to the patient. So you had your sick children, and then you also had like just your wellness, your general wellness checkup exams. So I got to see the difference between those two. And then, you know, she administered some vaccines here and there. And, you know, it was all very smooth, very different from what you would see in the hospital setting. Of course, the charting is always there, heavy charting for every encounter that, you know, the nurse has with the patient. That's basically all that happened. And so I asked this nurse, because she was asking me, so what area of nursing are you interested in? And I'm like, you know, I really don't know yet. I went into nursing wanting to be in the mental health field, but you know, I don't know anymore. So she was telling me, oh, okay, well, you know, I've been in pediatrics for a really long time, and she actually worked the floor, so she was in a hospital. And these are her words. She's like, now at my age, I would much rather be working at a clinic like this. She said how at a hospital it's so much a faster pace and you're always on your feet, you know. And for her here, it's a much more chill environment. Some advice from her was that as a new nurse, you should always want to go work at a hospital first, just because you're going to get that experience that you won't get anywhere else. The care is not always going to be as extensive as you would find in a hospital. So that's just like my 2 little cents. You know, this video wasn't really like, it wasn't really going to be like a long video or anything. I just wanted to kind of you know, talk a little bit about my clinical experience outside of the hospital. That's it for today, guys. Thank you for watching, and as always, make sure you like my video. You should subscribe to me, ask me some questions, leave some comments down below, whatever. That's it. Bye, guys.